now tuned in to the Cold Hard Truth, Cayman's #1 hard-hitting live podcast show, where we feature some straightforward conversations on political, social, and celebrity news and all things happening in the Cayman Islands and around the world. This show was created to give the people a voice and a means of being involved and informed without any filters. Sometimes it gets crazy, but we always keep it real. We bring you the tea, piping hot, so grab your favorite beverage and join the conversation via WhatsApp at 324-1612. Email tips@caymanmarlroad.com. Now, here's your host, Sandy Hill, broadcasting live from the beautiful Cayman Islands.
The Cold Hard Truth now has your Premier access with Premier Panton.
Hello everyone, this is Wayne Panton. Come and join me on Cayman Marl Road's Premier Access every other Wednesday at 7 p.m. for a frank and open Q&A session. I'm here to answer your questions about the issues that concern you the most. Tune into YouTube and Facebook Live on Wednesday. We will see you there.
Full transparency, answering your questions, down to earth, accountable, and accessible to who matters. You. Don't miss Premier Access on the Cold Hard Truth, spilling the tea like no one else.
Okay, folks, good evening and welcome to another segment of Premier Access. Thank you guys so much for tuning in as I see your numbers rising. Make sure you go tell your friends that we are live right now. Our apologies for running a little bit late, but I'm sure that you can appreciate the Premier is a very busy man. And, Tuesdays, Wednesdays, sometimes it's caucus on Mondays, cabinet meetings. He's got a press conference tomorrow. Lots going on, but he has still made the time, folks, to come and sit down with all of us this evening for the usual bi-monthly Premier Access segment. So just a little bit behind schedule, but no worries. We're gonna jump into the conversation with him. So get your questions ready, your comments ready. I do have Kevin Watler, who's on standby. He's gonna give me a little bit of a hand this evening because as you guys know, in the evening hours now, we are also producing a nightly news segment, which is the CMR Daily Buzz. So I'm in the middle of trying to get all the videos and stuff ready for that. That will go live about 9:30 tonight. We're running a little bit late. And we've got some big announcements exclusively on that segment. So make sure you tune in for that as well. So good evening. No further ado. Good evening, Premier Panton. Thank you so much for joining us.
Good evening, Sandra. It's a pleasure as always. And I want to thank those people who have tuned in and I know they're always asking very interesting and good questions. So look forward to having a good discussion tonight. And I apologize for being late.
That's okay. I know, like I said, that you're extremely busy. I have my first question of the evening. Have you done something different to your hair? It looks a little bit different.
A haircut.
Oh, okay. All right. Well, we'll take it. All right, folks. So we will get started with your questions. I know some of you sent questions in advance. So let me remind you that you can actually call into the show. It's super easy. You can just click on the link. As of next month, by the way, we are hoping, if all goes according to plan, that we're actually going to be on the airwaves. We're going to be on the radio. So guess what? Tell Granny, tell your aunt who may not have Facebook or YouTube that soon they'll be able to listen to the Premier right here in Premier Access on a local radio station. We'll give you all the details a bit later on, and they'll be able to phone in, call in with a regular phone as well. We're trying to work out the logistics of getting a little toll-free number sponsored and all that great stuff. But we are expanding into 2022. Premier, thank you again for coming on. I'm so excited about this year. Are you as positive about 2022 as I am? I don't know what it is about this year, but I feel extra positive. Every new year, I'm always positive about all the things that, I've got planned. But I feel like 2022 is going to be our year as a country, as a community, individually. What we're doing here at CMR. I just feel fantastic about it all. How are you feeling?
Well, I think we have a lot to be optimistic about, a lot to be hopeful in relation to. And I do think that, we live in a paradise. We live in a country that is so wonderful compared to many others. People here, even though we have problems, we have issues that we have to deal with. Sometimes they pale in comparison, to other countries that have real problems that are much more difficult to address. And their long term future, looks bleak. So we in Cayman we have been really truly blessed, and we live in a paradise, and we need to try to keep it that way and improve on it.
Absolutely. Because I'm always reminded, in the line of work that I'm in, sometimes I see things that kind of bother me and remind me of where we do need to make improvements. There was a little bit of an issue this week with, it was so obvious to me that these were expat workers who, although they didn't have to say very much, I could see were being taken advantage of by a Caymanian who's just hanging over their head that, my name is on the work permit, my name is on the business license. And I really hope that our people recognize that, we can't be good people if we take advantage of anyone, whether they're Caymanians or expats or whatever the case may be. I think it's a sad indictment on us. But let's say hello and good evening to Elizabeth. Miss Beulah's here. Carolyn is here, says watching. Marjorie, Miss Marjorie's tuned in. Wee, of course, has got it locked. And some of our usual. We're almost up to just about 100 people between YouTube and Facebook.
Okay.
So let's kick it off. We had some questions that had come in advance of the show, and we can certainly talk about a few of those. I still am getting questions about the ex gratia stipend. First of all, is that continuing? And for how much longer can we actually expect to see that? So just to remind our listeners, if they don't know what that is, that was a payment that was being extended to people who were finding themselves in quarantine as a result of COVID. And, if your company or your employer is unable to pay you for the 10 days or whatever amount of time that you're in quarantine, the government had put a program in place where, they were able to offer some assistance. And they've set up another, sort of entity that was helping people with groceries and, doing quite a bit to alleviate some of the hardship that people have been placed in once they go into quarantine. Do we know what's going on with those payments and roughly how long it's taken to process them? I think someone sent a question essentially saying that they had been waiting since November.
Well, I don't offhand. I can't tell you where. I can't tell you about the timing of payment, but I have not heard of any issues around that. I can say that the program is still ongoing. I can't tell you statistics around the numbers of people that have taken advantage of it, but I don't think that the numbers have been particularly high. From what I've observed, people tend to get a lot of support from the community, and I know a lot of my colleagues assist and organize with some of the other NGOs, who are charities that help people in these types of situations and other similar situations with food, with any kind of supplies they need. If they need somebody to go and pick up medication for them, wherever somebody doesn't have the family support unit around them and to be able to fill the gap like that, there are people who are willing to do it and help out. I have had one question or one request recently in relation to that program, but I haven't heard of any particular issues. I haven't heard of delays in relation to it. But I'd have to follow up, to be honest, and get an answer for you. Maybe I can get the answer and supply it to you, overnight or tomorrow sometime, so you can get back to your viewers in relation to it.
Yes, please do. Aina is watching from South Florida. We have Anthony joining us from the UK. Good evening. Good morning, probably, to Anthony. I'm sure it's early morning hours. And Sharon also shares that her husband has also been waiting since November as well. So maybe there are a few people that are in the queue and they'd like some additional information. So I will try to get some information.
Let me say that what I find more often than not is when there are delays like that, it's because there is insufficient information or there's a request for additional information that hasn't been responded to. But if there is another reason, then I'll follow up. They should sort of resubmit their request to the Ministry of Finance, and I will check on it and I'll report to you, and then we can take it from there. And if there's a new contact number or a specific contact number, I will provide you with that information. It's just that I haven't been asked specifically about it a lot,
right?
So it's not something that I retain in my head.
Yeah, understood. Today, there's a big announcement coming out of the UK that the Prime Minister Boris Johnson has effectively flung open the doors and decided to remove all of the Omicron sort of restrictions that they put in place. Some of them quite surprising in my opinion. So it's no longer going to be mandatory to wear a mask on like public transport. Even the kids don't have to wear a mask. He's doing away with quite a few measures, and I guess on both sides of the issue here. Some people are concerned that maybe he's going a little bit too far in the other direction in terms of throwing the window open. And, other people are saying good, and the Cayman Islands should follow suit. What do you say when people say to you, let's turn to what the UK is doing? Mind you, at the same time, they've admitted that the UK Health Service is under strain. But despite that, not only are they not going to introduce any new COVID-19 measures, they're actually going to remove what's in place. So what's your take on it?
Well, I'll tell you what, I mean, to people who say, let's follow what the UK is doing.
Yes.
Let me say, the UK has a lot more resources than we have. They have had a long history of massive amounts of COVID across their country. They also have a quite a significant vaccination rate, not as much as ours, but in terms of the two shots, they have a very significant rate. I don't know what the exact thing is right now because I haven't been.
I think they're actually better than us this morning because I was looking at their latest numbers. I think they're at 83%.
Yeah,
I'll double check that.
Yeah. I'm not gonna buy that one entirely. But what I do want to say is this: they have been very effective at rolling out the booster shots, right? They have
71%. Correction.
Yeah. Sorry.
71%.
71%.
Yes.
But they have something like of the, well, I don't know exactly whether it's a percentage of the double vaccinated or a percentage of the population. I suspect it's a percentage of the double vaccinated, but they're something like 60% of their double vaccinated population who have had the booster shot. We have not had. Right now we're hovering. I think we are around 27%. We're not even 30%. And to be frank, I don't think that it's a good idea that they make the changes that they're making. But they make changes, for a lot of reasons, including political reasons. I mean, you could, one might speculate that, there is a lot of reason to create some deflection and distraction in the country now because there are a few scandals that have been amplified in the press, and there's some pressure in relation to that. But I for us, I think that we have to reflect the science. We know that whenever you inject politics into the science, you usually have bad outcomes. And we have tried very hard to avoid injecting politics into our actions and into a position of conflict with the science. So we have our chief medical officer who has a tremendous amount of experience. She is originally from the UK. What was Public Health England is now the UK Health Security Agency, and she has the same sort of regular contact and connections that Dr. Lee had with other chief medical officers around the other territories, as well as dialogue with the UKHSA. The information, the advice that goes from places like the UKHSA to the politicians isn't necessarily followed, and they sort of balance it with other factors. We are to some extent doing that as well, but we have left. There's a lot of politics that they inject that we don't inject here. We try to make sure we're taking a balanced approach. We try to balance the interests of lives and livelihoods, and we have been working steadily in a direction of getting our tourism industry restarted. So we were basically 5 weeks late because of the pause to phase 3. 5 weeks later, we went to phase 4. Tomorrow we have a press conference, and we will be making some further announcements. I can tell you that they relate to phase 5. So I've watched what they're doing. I think it's really premature, but they have gotten used to a concept of trading lives. It's a big country. People are more or less statistics to most of the politicians. For us, it's a totally different thing, and we have to a large extent done better from a economic perspective. We've had an economic shock, but it has been better than in general than what they've had in the UK. And I think for us, we are making decisions that we think more accurately reflect a balance that the people of the country want, and transitioning safely into restarting the economy, getting tourism going again. And otherwise, financial services continues to do well. Yes, there will always be challenges around that, as there has been for the last 20 years. So we're always going to have some issues to deal with there. That, I'm afraid, is never going to go away. They keep reinventing the wheel on a lot of the issues there, no matter how well we do from an objective perspective or an assessment perspective. But yeah, I am not intent on following what the UK is doing. I'm intent, and my colleagues are concerned with me in making sure that we do the right thing for our country here when it's the right time to do it, based on the clear advice that we have from our own public health folks.
Right. Now, Dr. Newton has been on island. Has it been a month yet? I think it feels like a month.
Yeah, it's over a month since she's been here.
Yeah. So how is she? We're hoping to have her on the program sooner rather than later, but seems like we have some major changes coming. So as of today, we're going to go to weekly reporting of trends and statistical information. How is the search coming along? I don't know if you're being kept abreast of it in terms of finding a new chief medical officer.
I can only tell you that is ongoing. I don't know anything other than that. Obviously, that is under the purview of the governor, and they deal with those issues. They, sometimes they'll report, tell me where they're at and what's going on, but that's about all I can tell you in relation to that. But she's a delightful lady, wonderful person to work with, very, very knowledgeable, and I think she's doing a great job for Cayman.
Okay, wonderful. All right, so we do have a few questions from our viewers. And folks, again, just in a minute here, I'm going to let Kevin take over for a bit just so that I can finish up the evening news segment. We do have Nona who is asking a question. She basically wants to know about the code of conduct. So I think Nona asked about this last time. And she's asking a very interesting question here, whether or not it will include a clause specifically addressing extramarital relations. My gosh. I think the code of conduct is specific to criminal behavior and behavior in the LA, or how far will the code of conduct go?
Well, the code of conduct will apply to the conduct of an individual, both within in relation to the performance of their duties as a parliamentarian, as well as in relation to maintaining a certain standard within their activities within their personal life. Obviously, I think you as you alluded to, it is difficult to prescribe all of these types of things, and I have no knowledge about anything extra anything. So I can say that the code of conduct is not likely to deal with that type of scenario. It is about the conduct of the individual in ensuring that it's not something which brings disrepute to the office of a member of parliament. That type of thing. It is not going to be prescriptive in terms of a multiplicity of issues.
Right.
And in terms of where we're at with it, I thought that I would have it ready to deliver today, but unfortunately, I came into 2022 very optimistic that I would be able to get through a lot of the COVID stuff a lot more quickly, and things would settle down. But the challenges have continued. Let's put it that way. Omicron has thrown a wrench into a lot of things. Omicron being very infectious, we have significant case numbers, and we're trying to find ways to minimize the impact on people's lives once we understand better information around the facts and the science in relation to Omicron. So, the press release that you would have seen yesterday in relation to public health, obviously that didn't just come out of nowhere. There was a lot of discussion around that, but that made a difference in relation to those people within our community who have been impacted by being either a confirmed Omicron case or a probable Omicron case. And we at the same time, we're also discussing what other changes we can make to reflect the current information that we have, and how best we can balance these versus or balance the health and safety of the community versus the convenience and the ability for those impacted most to try to get back to some semblance of normalcy and be able to conduct their lives as normal as possible. So it's difficult to try to balance all of these things, and it has taken a lot of discussion to make sure that we're doing the right thing and approaching it from the right perspective. And we are nowhere near in a position where we feel that we can just throw out all of the all the protocols and say, sure, let's just go back. We're not don't wear masks. You don't have to bother to take any precautions. That's kind of like a let it rip kind of approach. That's not the approach that we advocate and want to take.
Okay. All right. And one interesting point I was thinking about as you were answering that question about the code of ethics or code of conduct, my apologies. Dealing with extramarital affairs. What I find so interesting, Nona, if people were really that concerned about that, why would you elect members who have had a history of that, even as elected officials? And we all know it. Like, I think Caymanians sometimes speak out of both sides of their mouth. If that was such an important thing, if you really wanted people who were, the true pillars of Christianity or, morality in that sense, you would probably not elect a few individuals that are in the Legislative Assembly right now and who've been there for 15, 20 plus years. So maybe that's where it starts, Nona, as by people, if that's important to you, and I imagine that for some people it is, they stop being fooled by people who just show up to church, my apologies, and portray a certain image. You should start looking at the substance of your candidates before they even get in to the Legislative Assembly, and then, having to then try to curtail their behavior by a legislative code of conduct. To me, that would be the easiest way to address that. Sanya, good evening. So good to see you. Sanya says, how long will parents that are fully vaccinated have to quarantine when returning with kids under the vaccine age? Seeing now positive people will only be doing 6 days if vaccinated.
7 days.
This is the $1 million question, I know.
Right. Well, tune in tomorrow to the press conference. We'll have discussions around those types of issues then.
Okay, so Sanya, some changes are coming. Stay tuned for it. Chantal, good evening, says we need to go back to normal. If you're vaccinated or not, it's your choice on how you want to live your life. So Chantal is much more into, let's get on with it. Jamie, good evening. Jamie says, watching from day 11 in quarantine with 3 healthy children under the age of 12 who should be in school. We all tested positive for COVID on our travels to Canada. We isolated there, got official recovery letters from the Canadian government. Why are my children quarantined for 16 more days? Just to find out that they don't have COVID again. Who is the contact at Public Health? Dr. Lee is still the only email available. Well, Dr. Lee is no longer here. So,
I think, if Jamie would go to exploregov.ky, you will find a lot of contact information there, a lot of information around rationales and the protocols, procedures, and contact details. Dr. Lee, as a matter of fact, was never. He was the chief medical officer. He is not a part of public health itself. Public health is a separate unit. The head of public health. Oops, there goes my my 8 o'clock lights off. But public health itself is led by Dr. Samuel Williams Rodriguez. So he would be the individual to be contacted. Obviously, there are other contacts there as well. The chief medical officer is a part of the ministry itself, the Ministry of Health and Wellness. So Dr. Lee was not the primary contact when it came to public health itself.
Mm-hmm. All right.
Well, we've discussed this many times. There is a rationale for having the current quarantine requirements for unvaccinated children, unvaccinated people. And who have traveled, I should say, travelers who are unvaccinated, in particular children. Children are not able to get vaccinated. So, we have to reflect a certain reality that they can end up being very good vectors for a variety of variants of COVID. The lady said, as part of her facts that she set out there, she acknowledged that they went to Canada and got COVID. Mm-hmm. So you got over COVID. That could have been Delta, for example. Mm-hmm. And as 5 days later or 10 days later, you could have come into contact with Omicron, as a different variant that had significant changes that your Delta sort of natural immunity wouldn't necessarily give you any protection against. So you could come back positive with Delta, or it could be a completely different variant that we haven't seen before. Right?
And this is
a problem. I just want to make this point. This is a problem with Cayman, or not a problem, but it's a reality with Cayman. We have people who leave here, go on trips, and they go all over the world. It's not just a trip to Miami. We have 130 nationalities here, and people go all over the world, all corners of the world, and they make trips. And they make 2, 3, 4 stops, and you just don't know where these the people have gone and where the risks may be coming from. So that was your initial justification for a distinction between the way you treat people who are unvaccinated kids in the island, who may have a positive in the house, versus unvaccinated kids who have traveled with their vaccinated parents. Now, at some point, that rationale may not be supported by facts and circumstances. And as we know, these issues, these standards, these protocols evolve based on science, based on changes in circumstances. And we're at a point where we can reconsider some of these. And as I said, tune in tomorrow to the press conference. You'll get more details around that.
And I must say, your point about just a little bit of, what my personal observations have been. I have known of multiple people who went away for the Christmas holidays, to Jamaica in particular. I was telling people this in the morning segment. My friend, he came back, and my husband saying, "Oh, why hasn't so-and-so come over to the house?" And I said, "Hold on a second, pump the brakes. Maybe we don't want him to come over after just returning from off island." And sure enough, he returned, got a clear PCR test 24 hours before. 2 or 3 days later, tested positive. And that happened on the 7th, which was Friday a week ago. I was then prompted to message the helper and say, "By the way, when are you coming back?" I said, "Please do me no favors this time," because normally she rushes to get to me. I said, "Take your time, at least 5 days, lateral flow test before you come to me." And sure enough, she came in on Friday from Jamaica again. By Sunday, she was positive. I was speaking to the AC guy who came in. He was part of the flight frustration on Sunday over the weekend. Right. And so he ended up coming, I guess that was Monday night. And I said the same thing to him. I said, "Listen, when you come in, over 70% of Jamaica, 7 out of 10 people, their health minister is saying are COVID positive. And they have a very, very low vaccination rate. I said, when you come in, I would tell you to be very, very cautious and, maybe keep a low profile." And sure enough, today he messaged me and he said, "Sandy, I'm glad you told me that, because I actually took your advice seriously." And sure enough, today, him and his wife both tested positive. And we've got another lady here who's a fan of the program who shared with us that she has now been infected twice. And just today, she found out that her husband now has it. And she's wondering if she could get it a third time, which would be kind of crazy, but you can get it multiple times. Kevin, I'm going to bring you in on this bit, because I know you have had a lot of experience putting together the CMR COVID Spotlight series. And of course, that people can get the coronavirus, COVID-19, multiple times. You yourself is now a survivor. You've had it and did pretty good. You were completely boosted up. So when you hear people agitating, this has been something a lot in the local community, when you hear people agitating for wanting to lift restrictions when it comes to children, what are your thoughts? Because I feel sympathetic, because I have a child, but I've made the decision that I'm not going to travel if there's not some emergency situation, like health-wise, that I'm really going to just stay put. And that's the choice that I'm making. But I do hear parents complaining. They want to see family who they haven't seen in a while. They want to travel more freely. And then, you know what I think? I think, my God, I cannot imagine being the leader of this country and having the first child die of COVID in this country. And then you have to answer to that. You know what I mean? All these complaints will go away, and you'll be like, you'll always feel responsible somehow for being in that position.
Yeah, absolutely. No, I mean, you can't be in a rush. One of the reasons I didn't even come home for Christmas, even though I could have, was because it was just too crazy. Too much was going on. A lot of changes was going on. Omicron was just starting to peak or rise, and it was just not the right time. And so if you really don't have to, you have to think about just delaying it until things get more calm. And then, of course, if you do decide to go, there are going to be protocols, whether it's coming to Cayman or going to other parts of the world, because the Cayman Islands is not the only place in the world that does have strict restrictions. Maybe the US might be a lot more relaxed, and maybe UK now might be more relaxed, but that's 2 locations. There's other places in the world that do still have these strict protocols, because They know their population. I know the government's doing an amazing job at making sure that we're protecting our very vulnerable population, and the data is already showing how such an amazing job Cayman Islands has done to keep the residents safe.
Mm-hmm. Okay. Well, Kev, I'm going to let you take over from here. Premier, again, thank you so much. I've queued up a few questions in that section there for you, Kev, so just have a look at your screen. I've started a few of those for you that are quite good. Good evening, Miss Vernita and Miss Opal and everybody else that is tuned into the program. And I'll get to doing the evening news while Kevin continues the conversation. So everyone have a good evening. I'll see you guys tomorrow morning at 7:30.
Thanks, Sandra. Have a good one.
Thank you.
Well, Premier Panton, man, I guess I haven't seen you all year, huh?
Yeah, but it's been a while, huh? I haven't seen you since last year. But anyway, it's always good to see you. No matter how long and short it has been, always a pleasure, my friend.
Absolutely. So bringing you greetings from Lakeland, Florida.
Okay. Huh?
So bringing you greetings from Lakeland, Florida. It's amazing how technology allows us to do things like this.
Absolutely. And
yeah,
I heard that you had COVID, and glad to see that you're on your feet and everything is well. So you're one of the lucky ones. There are people, unfortunately. I mean, most people tend to be okay, but there are lots of people that have a miserable time with it. And then, of course, there are those that get really, really sick. And it can get worse from there.
Absolutely.
So happy to have you on and being able to chat with you.
Thank you. Yeah, no, my experience with COVID is very mild. I got the vaccine as soon as I was able to. I got boosted back in October. It was because I was able to get it much sooner than a lot of people, and I'm so glad that I was fully vaccinated and boosted, because again, I had such a mild cold. Really, it was not. I had worse colds, in fact.
Right, and that's the benefit of having the vaccine and being boosted, right? Mm-hmm. I mean, some people who get that, who have been boosted, get sick, and some of them end up in hospital, right? But imagine how much worse they would be, or you can imagine easily that their life could be at risk if they weren't heavily vaccinated, if they weren't boosted like that. And Kevin, one of the challenges we have here is we've done a great job with promoting the vaccine uptake, and we've got a good uptake. We've got the clear evidence of the benefit of that. We've had lots of COVID infection here, obviously not relative to Florida. This is like not even one day in Florida, a third of a day in Florida, where we're at for the last 2 years. But relative to our sister territories, as an example, they've got less COVID, and they've got 10 to 15 times higher deaths and that sort of thing. We've had our share of pain, but we've done relatively really well. And I put that down specifically to our vaccine rate. And what I'm struggling with is how to motivate people to get out there and get the booster, because you know how important it is. I know how important it is. I went and got the booster, and I'm constantly begging people to go get their booster shot. And I don't, we're talking about 27% of those individuals who are fully vaccinated. So yeah, just under 27% right now, I think, of those who have gotten vaccinated. We should be at 60%. We should be at 65%, because it is really, really important. It's really essential for us. It helps to protect not just ourselves, but it helps to protect our healthcare system, and it helps to protect our families and friends, because if we don't catch it, we can't be a part of the chain to pass it on, right?
Mm-hmm. I used to brag with my coworkers when I worked at the health department, saying, look at the Cayman Islands and how such an amazing vaccination rate we have there. And at the time, we had only one death at the time that was very early in the game. Right. And there was like, man, why can't we all be like the Cayman Islands? Let's keep that momentum going. We can't say that as much now with the booster program. So let's keep that momentum going. So we have more people protected, because again, there's going to be more and more variants in the future. Omicron is not going to be it. There are going to be other things that's going to eventually pop up. And as the medical science and everyone starts to research how better we could battle COVID, we need to make sure we're doing everything to stop the virus from keep on starting to mutate, because again, we have more protection.
Yep, absolutely, absolutely. And you know, a part of that is not necessarily within our control, but we can be good advocates, right? We can say, look,
Absolutely.
those countries around the world that are poor, that have limited access, that have significant populations at risk, they need to be vaccinated, because the quicker they're vaccinated, the more they're vaccinated, the less of a reserve it is out there of COVID that can continue to spread around and impact us.
Yeah, absolutely. Well, we have a question from Michelle, getting back to the viewers. Why can't we utilize doctor's hospital or anywhere else for PCR testing of a positive lateral, so we don't have to wait 72 plus hours for results? This shortened isolation period is all smoke and mirrors. Stop the madness with and make it make sense. Why are you okay with kids and elderly standing in the sun between 1 and 3 p.m. with 50 to 100 other positives waiting to get a PCR when they already know they have COVID? And of course, they're reiterating their frustration.
Yeah, listen, and I understand that frustration. That is why, whenever we observe things like that, whenever information comes to our attention that that's the case, we engage with public health. We have the discussions to say, look, here is what we are observing. Here is what we are being told. Here are the real experiences of people of all ages. There are people who feel ill. There are people who are elderly, and we've got to make sure that they are comfortable, and that they are safe, and they can get processed as efficiently and as quickly as possible. So that went from a situation where we had the one test center at the South Sound Civic Center, and it was clear that it was being overwhelmed. So we then got them to set one up in Town at the Civic Center in Town. We then got them to reopen or reestablish the other one at the football field in West Bay. I think it is it Ed Bush Field? I can't remember exactly where it is there, but so that was that we went from one to three different locations being operated. Initially, the South Sound one was 2 hours, and we or an hour, I think. Actually, we extended it by another hour or two. So we have been reactive and responsive, and we, in a broader sense, in terms of all of government, in terms of health services, in terms of the public health body. We have been reactive, and we have tried to make sure that our people can get the most efficient and effective service. Has it been perfect? No. Do we have limitations? Yes. That is why we have to manage things carefully. Are the public health people tired? Have they under stress? Yes and yes. Have we been giving them extra resources? Have we been following up and getting them to get additional staff? Yes and yes. But the problems have escalated at the same time as well. So it's Omicron, for example, came along at a time when our daily infection numbers, which were presumably almost all Delta, almost certainly all Delta, were in the range of 30 to 35, 40, 45 per day. It's possible now with Omicron to have, I think a couple of days ago, we had just under 500. So it is a very difficult and a changing set of circumstances, changing sets of challenges that the country has to respond to, in a measured way, in an appropriate way. And so there are challenges, and the people who are doing this are real people with real families themselves, and they're under stress. You're in the public sector too. You know how they have to respond And when they're not immune either, they're not immune from catching COVID because they're in that environment all the time around people. And so when they get sick, they end up having to stay home and isolate and prevent others from getting infected. And that in turn puts lots of additional stress on their colleagues to be able to fill gaps and continue to cover. So that's why we all say this is a collective effort. We've got to protect people. We've got to try to slow down the rate of transmission. We've got to try to protect our public health, protect our health services folks, all the different hospitals. Collectively, a positive collective action. I didn't like to say the word positive anymore, but a good collective collaborative action by all of us leads to better outcome for the whole country and for everybody.
Yeah, and I will say that issue is not even unique to the Cayman Islands.
It's not. That's
Here
not.
in Florida, we have a lot more resources, a lot more medical staff on hand. But you got to understand there's a lot of logistical challenges that goes on behind the scenes that it takes a lot. And we had people waiting all 6 hours at times when we started to see a significant amount of cases, that we even had people dropping down, and we got some bad press from it, but it was a realistic thing that did happen. Cayman Islands, I don't think we had a whole lot of that if it did happen. Cayman is still in a much better position. And so it's not unique to Cayman, and you guys are just learning from your mistakes to make it even better, because it's not going to be perfect all the time.
Right. And as you say, I can't say that we've made a lot of big mistakes. There may be some small mistakes. There may be unanticipated things, but I will tell you that I'm very proud of the men and women who serve this country in the healthcare area, both in public health, the ministry, and HSA and their staff, Health City, their staff, Doctors Hospital, their staff, all the other doctors in Cayman. Everybody has been contributing, has been involved, giving advice. On more than one occasion, we have had a round table of doctors, those from public health, those experts from the ministry, as well as a range of private sector doctors. When we have to discuss matters of policy that we can benefit from their collective medical knowledge and experience and advice. And I'm very proud of the work that these folks are doing, and we've got to recognize that, and that's why we've got to act together to help reduce the risk, reduce the rate of transmission, and help each other out, help the country.
Absolutely. Well, we have a question that came on WhatsApp, and it's asking if you can, what is the penalty for positive lateral flow tests if they're not reported, and who monitors these positives?
Well, I mean, one of the problems with the national lateral flow test policy is that we recognize that it is, in terms of positives, it's an honest system. If you test and you find that you are positive, you are under a legal obligation to report it, because it is a communicable disease, and as a communicable disease, it's reportable under the Public Health Act, and it's an offense not to do so. The problem is that, if you take a lateral flow test in your room, and let's say you don't have any symptoms, let's say you're asymptomatic, it may be that someone may not ever find out that you are positive. You may keep that a secret, and nobody ever finds out. The problem is that you may go around, you're asymptomatic, and you are then deliberately putting others at risk. Others may be getting infected from you, even though you're asymptomatic. I mean, that issue has been resolved a long time ago, as to whether you can be infectious and transmit that infection while not having any real symptoms yourself. So, this is an issue that we have, and we have to appeal to people to do the right thing, do the right thing for themselves, do the right thing for their family, and do the right thing for their community. Now, sometimes and oftentimes during doing the right thing comes with a level of inconvenience and a cost to us. And the government recognizes that. We understand that there are certain challenges that people face. That's why we have programs in place to help people, to assist people in terms of being able to feed themselves, in terms of being able to provide them with some basic levels of income if they have an employer who says, guess what, I don't care why you're not at work, I just know you're not at work and I'm not paying you. And that's another issue that it's you end up in a situation where you can understand to a certain extent a small business scenario, where they find that they don't have any other choice but to say that. But I suspect that too often it's just employers that are being unreasonable, and just sort of taking advantage of the situation. But there is undoubtedly a level of inconvenience, and there may be a significant level of cost for them as well. So I am not going to unduly criticize everybody in that sort of context. But what it does require is for all of us to have an appreciation for the different risks that are being taken, and try to take an approach which is more balanced. If you need assistance, if the individuals need assistance, if the businesses need assistance, they can ask for it. They can contact us, and we'll try to find a way to help them. We have programs to help small businesses. We have programs to help individual families, and many of us, do it ourselves. We'll sometimes I've gone out and picked up stuff and gone to drop them off on the doorstep of people's houses, knock on the door, or you walk away and call them and you say, I just put it on the doorstep. We're all here. We've got to help each other, right? And this, as I said, I've said many times, it requires a collaborative effort.
Absolutely. Almost remind me of after Hurricane Ivan, when we all were helping out our neighbors who might need something. I mean, that mentality, bring it back.
That's a community spirit.
Yep. So we have Jane asking what we should really be concerned is about the healthcare workers. I know you touched on that, and how are they doing?
Yes.
Yeah.
And that's exactly right. That is what we should be concerned about. We should be concerned about the ability of the safety of our healthcare workers. We should be concerned about their health, and not just their physical health, but their mental health. The tremendous amount of stress they're under. You listen to some of them talking. They will tell you stories, particularly when they're working with people who have passed away. Mm-hmm. It is just gut wrenching. It is soul destroying for some of them to be in situations where people are saying, help me. People are saying, you know what? I was silly. I decided not to get vaccinated because I watched something on TV that said don't do it, or watched something on YouTube that said don't do it. But I want it now. And you have to tell them it's too late right now. You have to get past this. You have to survive this first, then wait a period of time, and then you can get vaccinated. Some people don't get that second chance, and that is very taxing for our healthcare workers as well. I mean, I can tell you how I feel as Premier of the country when anybody dies from COVID, specifically from COVID. Yes, we have lost people who were, who had significant healthcare challenges, who had significant illnesses, and they also had COVID. Perhaps, the COVID sort of accelerated some of the issues they had. Perhaps it had nothing to do with it. Perhaps, they were unfortunately going to pass away anyway. But while you're very sympathetic and empathetic to people who are suffering illness through no fault of their own, it's quite another thing when people have the ability to get vaccinated, they end up getting this thing, they end up getting sick, and you see the crushing pain that it brings to them and their family and their friends. I mean, losing someone is very painful under any circumstances at any time of the year. but I've had the unfortunate, experience of watching people, particularly over the holiday period, go through some real crushing grief because their loved ones weren't vaccinated, got ill, and unfortunately they were the unlucky ones.
Yes, absolutely.
So we got to protect the healthcare system. We got to protect the healthcare workers. If the healthcare system gets overwhelmed, um, then we're all in trouble because you know that's when people really start dying. That's when the resources become totally inadequate to maintain the life of individuals. Thankfully, we have not gotten to that point, but we have put what are viewed as strong controls in place, and people view some of these protocols as too restrictive. But it's too late to lament the fact that you didn't put in strong controls when you end up in a situation where you have your healthcare system failing. You've got to have those strong controls and put up, unfortunately, with people having objections and saying I don't like this, because at the end of the day, what's more important, them saying right now I don't like this, or them being alive 6 months from now to look back in hindsight and say, you know what, we got through that, and I'm still here, thank God.
I work with a lot of healthcare workers here, and the amount of friends that I have that are now in therapy who never used to go to therapy, because I mean, over the last couple of years, it's been incredibly stressful, and so definitely, I know you're a big advocate for mental health as well, and so it's something definitely that, especially those first responders in healthcare. And even the EMS workers who might have to deal with some of these very complicated situations,
Yes.
definitely need to be allowed to have that extra assistance, because we all are human, and we all have breaking points.
Yeah. And I see that question there from Michelle. I I agree. I have been trying to reduce the amount of time that we spend speaking at press conferences. Um, and I would suggest that, they put their questions through to the journalists as well. Send them to as many of the journalists as you can, because you increase the chance that you might get your question answered. But here I'm here today, and I'm here every 2 weeks to answer questions as well. Um, to get the best benefit out of it, it would be useful for me to have the questions in advance so that I can get information that I may not have at my fingertips. Um, my head is big enough as it is, but it only holds so much
Yeah,
stuff. So
absolutely.
I love to be able to engage with people and address people and try to help them with the information they're seeking. What is great is we do have a lot of chat groups where people are very good at sharing information, and I think it makes the community better, all the better for it. But I'm certainly happy to have more questions put through, and I'm trying to keep the press conferences to no more than an hour and a half, and less if possible. But it just seems that it's always difficult when you're
Absolutely.
trying to you're trying to convey information to the public, and you have to decide, well, this may be too long, but which information do I cut out in order
Mhm.
to be able to provide information. So we
Absolutely.
try different methodologies, and this is one for me to be able to have to engage with the public and answer questions. And if we can get it ahead of time, um, or if it's something that I know offhand, of course I'm going to answer it.
Yeah, people got to understand the purpose of a press conference. It's not for public questions. The media is there to ask some questions. The where you have this
Our
access is
message.
right here on the Premier Access.
Yeah.
Premier Panton, like he said, he's here every other week on Wednesdays to do and answer your questions. So it's
Right.
the role of the media to help get those questions answered. But of course, the higher level or the more important and pressing questions, they ask live right there at the press conference. But the press conference is to give a good summary of what's going on, and a higher level overview of what's changing, what's coming up, whatever information is coming out. It's called press media press conference for a reason. So, but yeah, we'll go on to the next question from Jane. Mr. Premier, if there were restrictions in place where there would be less COVID in the community, which means less quarantine, less COVID cases, less quarantine. Have any comments on that one?
Well, I'm not sure why she thinks there are no restrictions, because I think there are a lot of people out there who would argue to the contrary. Every time we put restrictions in place to try to limit the amount of COVID in the community, and thereby limit the amount of time that people end up, spending, not on an individual basis, but on a collective basis, spending in quarantine or isolation. There are always complaints. There's always one side who is in favor and the other side who is against. And in this, unfortunately, there are times when you have to put things in place despite the protests, despite the complaints. There are people today who want me to do more. Wanted me to do more yesterday to open up things, to reduce restrictions, to allow children, for example, to come in unvaccinated. But there are those who yesterday and today and last night have been messaging me saying, shut the country down, lock it down. You're never going to please everybody.
Yep.
We're trying to find a path through that gives the best possible balance of life and livelihoods.
We have a question, and I know we answered it already, but I'll let you answer this one once again. Do you still need a booster shot?
Oh, I don't need a booster shot. I've had mine, but yes, the country needs those people who have not gone out and gotten your booster shot, please go and do it. We are, at this point, we are saying anybody who's 18 and over who got the booster shot 3 months or more, the
second shot, yeah.
Second shot more than 3 months ago, you're entitled to go get your booster shot. Please go and get it. It is going to offer you substantially better protection than you have even 3 months after your second shot. And that is very critically important in relation to Omicron, because Omicron because it's a variant that has had very significant mutations, the vaccines are less effective against it. The good news is the Pfizer vaccine that we have is the best vaccine. The only other one that is, equivalent or close to it is Moderna. And those vaccines have been the most effective against preventing illness and against, even reducing the chance of getting infected. So please, folks, if you have not been vaccinated, and I know there are many of you. I know there are plenty Caymanians, there's thousands of Caymanians out there who have chosen not to get vaccinated. Some of you there are a variety of reasons for that. Some of you, have been listening to misinformation. Some of you have doctors or a doctor that perhaps that has influenced you in a particular way. For some of you, it is some, interesting construct of, your own particular view on religion. But the reality is that is not the way you should be looking at this. This is about your own personal health and protecting the health of your family and protecting the health of your community. And these vaccines have been tested, they have been monitored, they have been assessed, and they have been approved by all of the major regulatory agencies in the world with the significant expertise to deal with approval of vaccines.
Yep. And I was looking at the World Health Organization, the last message that I got from them, which should be updated, I think, sometime by the end of the week. But so far, out of the amount of vaccines administered, 9.1 billion doses of each individual jab. So that's a whole lot of it. And we know that's
Yeah.
that,
I mean, look
that
at the numbers that we've had
not
here.
there.
We must be about 140,000 or close to 140,000 shots administered in Cayman.
Yeah.
And there are still people that believe that the vaccines are putting people's lives at risk. They're not.
Yeah.
Not getting the vaccine is what puts your life at risk. Getting the vaccine may give you a headache. You might have a fever. These are all normal things when you get vaccinated. Heck, these are normal things sometimes, even when you take certain types of medication.
Mhm.
There are certain antibiotics that you take. You can't go out in the sun
Mhm.
because you'll feel blistered. You'll make you unwell. These are all things that happen when we take certain types of medication to help us to improve the level of our own personal health. And I don't know. I wish I could find a solution to convince people, those who have not been vaccinated, to just go out there and get vaccinated. But I can guarantee them one thing: they will not regret it.
Yeah.
And getting the booster is essential right now, because we have really benefited from the level of vaccinations that we've had. People have generally been very safe, and we need to continue that by having people get the booster.
Yep.
And the other point is, and I'm going to keep saying this as well, I look at the numbers every day, every night. It's one of the last things I do before I go to sleep. I check the hospital stats. And when I know some of the individuals who perhaps are in hospital, I check on them individually. I don't get into their personal business. I just say, look, I happen to know that so and so is there. Give me a general idea. Are they are they doing better, or are they stable or whatever? Um, it's because I care about everybody. Our government cares about the well-being and lives of our people. That's one of our first obligations, is to make sure that they're safe in this country. And I can tell you that the people that are in hospital, that are at risk, and I can tell you every single person that I know of who has died in this country from COVID has been unvaccinated. And the vast majority of people that are in hospital are unvaccinated. If they came in vaccinated, I'm not saying that people who are vaccinated don't end up in hospital. Sometimes they do. But what tends to happen is they come in for a day or two or three, they get the necessary support that they need, they get the treatment that they need, and then they end up getting discharged and they go home. And they're okay. They manage it and they get through the rest of it until they're clear of the infection. But the people that we lose, and it's a painful, terrible reality, but the people we lose are people who are unvaccinated. Those, the ones that we lose from COVID, is because they're unvaccinated. And I need people to understand that. I need people to reflect on that and understand that the vaccine is safe, it's approved, it's not going to kill you, and it is going to be your best chance to save your life. Because I can promise you one thing: every single person, unless you lock yourself away and have a miserable, isolated life for who knows how long, every single person who is unvaccinated is going to end up getting COVID. And you can get COVID multiple times. I've known people who have nearly died the second time around, lucky enough to survive it.
Yep.
Anyway, I almost feel that I'm COVIDed out.
Yes.
It's really stressful, and it's here it is. It's 8:45 at night, and I haven't gone home. I've been working on a variety of things, but it seems that half my day is usually taken up dealing with COVID related matters.
Yeah.
And I would
And
love to get to the point very quickly
Hmm.
where that I don't mind dealing with some of it. I do, I work with with my colleague, the Minister of Health, who does a fantastic job. Um, but there are times when I have to be involved as well, whether it's messaging, whether it's policy making, um, and I would really like to get to the point where, there's an hour of this for the day, but we can then deal with a lot of the other policy issues, a lot of the other um, initiatives and plans that we have, and budget that we can roll out to make the lives of our people better in other respects.
Yes. So Opal's asking, with all of the changes, we who depend on cruise ship tourists still can't hear nothing concrete when ships are going to be coming, but they know the information that the stipend is going to be cut out, and they obviously want to work. So hoping to have a little bit better idea when cruise ships will be allowed to come again.
Yeah, just quickly, Arnell, I saw you on there earlier, so hello to you, all the way from the Philippines. Opal, we are still, we respect the cruise industry, and we are trying to make sure we can get back to having a cruise industry, a cruise business in Cayman, which helps to get our people back to work and keep them involved in earning a living. Um, we are working on a strategy in relation to that, which encompasses better outcomes for all of our people, better outcomes for the country. But this issue around cruise is not an issue of Cayman saying no cruise. It is an issue which is global. It is an issue which the U.S. Centers for Disease Control have been looking at very carefully as well, and they have made recommendations to people to not cruise at this point because of the issues with the difficulty of trying to avoid a ship full of people from getting infected, both in terms of people getting sick on the ship, but also people getting sick when they come ashore or infecting others. So there's a strategy. We are talking to the cruise lines, and we're looking for a way forward in respect to that. We're making a lot of progress, I think, and tomorrow you will hear some of the significant changes that we're rolling out in order to demonstrate that will have a positive impact on the lives of people. Um, the cruise ship and the cruise industry is one that we will have to continue working on, and that's going to be a few weeks down the road. But we've said it before, and I'm going to say it again, and I'll say it again probably. We, Opal says, we know the stipend soon cut out. We have not said that. What we have said is we are going to continue to support those people that are impacted negatively by the shutdown of the cruise industry as long as we need to. So that, I think, people need to understand. They need to get clear about that. We have not said that there's a date at which that ends, because we know that would be unfair to the people who are unduly impacted by the shutdown of cruise, and it's not their fault. To a certain extent, it's not the country's fault either. But we understand that we've got to address their needs at the same time as we're trying to make sure that we find a way to safely move forward with cruise in a way which benefits better everybody in the country.
Yep. And then we have Jackie asking, with the recent cost of PCR testing that is required by some employers for all or some employees to get PCR testing, why hasn't the government mandated that employers pay for their staff to be tested? Some people are stressed with salary loss due to isolation, job loss, or making less salary for whatever the reason. I think government should reconsider charging public $75.
Well, Jackie, the issue is this. the government has spent tens of millions of dollars. Well, at this point, it's safe to say it's in excess of $100 million in relation to COVID costs. We have had free services provided for a very, very long time in terms of testing. It was done on the basis of it's in the interest of the country to do it from a public health perspective. But it was very clear that as well that a lot of people benefited by utilizing services that were for free, to be able to free themselves up to go and travel, to get permission to go and travel, and to do other things, and to comply with employers' reasonable requests, in my view, to be PCR tested to keep their work environment safe. I don't personally think that employers are unreasonable just because they're asking staff who are saying, I choose to not get vaccinated to get tested. Some of those people may be able to work from home. Some of them can't do jobs that they work from home. Some of them are frontline people, and they're serving other people and interacting with other people. It is therefore, legally important for employers to know that the individuals that they're putting forward to work on the front line and interact with the public are people who aren't infected. And frankly, for me, I think it's unreasonable for individuals to say, you know what, I don't care. I don't care that I'm putting others at risk. I don't care if my employer wants to know my vaccination status, then let them pay for it. Not my vaccination status, sorry. My infection status. Let them pay for it. No. We have a free vaccine that's being given to the people of this country. You don't have to pay a cent for it. And it protects your life. It protects your family. It protects the lives of your loved ones. It protects the lives of people in your community. And if you are going to insist that despite all of that, you are not going to get vaccinated, then if your employer says, you know what, I don't want to fire you, but I'm going to require you to take these tests. And if you are going to say you choose to remain unvaccinated, you've got to pay for it. I don't think it's reasonable to ask government to pay for you exercising your freedom of choice to not be vaccinated. And I don't think it's fair to insist that your employer should have to pay for it, because they're trying to keep you in a job that they have legal obligations to make sure, when you interact with their customers and their clients, that you are safe, you are not an infection threat. Actually, it's not even just the customers. Think about all the other staff. Think about co-workers. If a business has 3/4 of its staff suddenly out sick, that might be the end of the business. Mm-hmm. So these are complicated issues, but I may have others that may differ from my view, but I don't think it's government's obligation to pay for it. The government has spent a tremendous amount of money on COVID-related costs. I mean, we're treating people in hospital who have COVID, who are unvaccinated, and I haven't had anybody coming to me and saying that a bill is being sent to the individuals. You know who's paying the bill? Government. Mm-hmm. If people choose to remain unvaccinated and they get sick and they end up going in hospital, government ends up footing the bill for it. And is that fair to government? Is that fair to the rest of the community? No. Is it fair to the other people who might need those services and they might need that bed that an unvaccinated person is sick in? No, it's not fair to them either. So this is just one more reason for me to encourage people to really think about about the way they look at this issue and go out and get vaccinated. One of the things we did, I noticed she referred to the $75. One of the things we did was implore the service providers and the HSA to drop the cost. They dropped it to $75, which was half of what was being charged before. But now, we're being asked, it's being said that government should pay for this. Government has paid for a tremendous amount already. And it's time for people to take responsibility for the consequences of their own decisions.
So Jamie's asking, why about vaccination? Why about vaccination for children under 12, and not just those that are vulnerable, who I agree should be first, but when will healthy children be offered the vaccine?
Well, Jamie, this is an issue. This is a matter that we've been working on for several months now. Ever since, Pfizer came out with the kids vaccine that they got FDA and CDC approval for. They now have approval from the UK MHRA. They have, there's a two-step process there. The medicines and whatever it is, MHRA, that's the acronym. But it's a regulatory authority. They approve it first. Then the Joint Commission on Vaccines and Immunization in the UK decide how it's going to be rolled out. So initially they said, well, we're not going to recommend that this be given to children. We tried the avenue of going directly to Pfizer, and we have been pursuing that avenue at the same time as we've been saying, to the UK, to the JVCI, look, please give us permission to administer this to children. We have a lot of children in Cayman whose parents want them to get vaccinated because they feel that they're potentially under threat. Yes, sometimes it's because they feel that they need to travel more safely with them. Yes, sometimes it's because they just don't want to have the vaccine to quarantine when they come back. But whatever the case is, we have a lot of interest and a lot of demand. Right now we have authorization to administer it, as she has noted, to children who are vulnerable or immunocompromised, serious illnesses. That referral has to come from a pediatrician or a doctor. We also are able to give it to children who live in a household with compromised individuals. So it's an attempt to help protect them as well, provide that vaccine wall of protection. And in a wider sense, in terms of those who are 5 to 12, we are, or 5 to 11, we are, I think, on the cusp of getting approval to go ahead and do it. I can tell you, there is almost not a day that goes by that I don't have a conversation with our governor in relation to that, because I don't deal with the UK authorities directly. It is done through the governor's office, and on a daily basis I follow up with him. Please, can you tell us, have we had any movement on this? Have we had any progress? I think it's very close. I would use the word imminent because it's been used to me, but I don't know whether imminent means tomorrow, it means the end of the week, or the beginning of the following week. I just don't know, but I think we're very, very close. I have not had the word imminent used to me in the 4 or 5 days prior to this. So when I hear imminent, I take people at their word, and I think it means days, whether that's 10 days, 5 days, I can't say, but I think we're very close with that.
So we got someone at Amplify Cayman is asking 3 questions. The first one is, what oversight is being put in place to measure the success of the efforts? Asking so we can hold, and then the other ones are going to come in afterwards. So asking so we can hold said oversight body to account to provide support staff if needed.
Efforts in relation to what? I'm not sure. Not sure I follow the question.
Let's see what if this second question clarifies it. Is PAC doing with the idea that we need population growth to reach 100,000 for waste to energy plant to become sustainable? And if so, what steps are being taken to address the needs of a larger population?
We are not going with any such idea. We have no plans. We have no strategies. We have no initiatives. We have no policies which are designed to try to promote growth to 100,000 for any reason. Growth, in my view, in terms of population, should be rather organic. Where we're at now is, we have an island that people already feel to some extent is overdeveloped. And it makes no sense for us to try to pursue any objective to try to chase a particular population number. I mean, why 100,000? Why not 200,000? Why not 300,000? It's a very arbitrary thing to pick a number like that. I guess we are closer to 100,000 than we are to 200,000, and maybe we will get there at some point. But we have got to do things in a way in this country that leads to a better result, irrespective of what the population number is. And this has not got anything to do with an waste energy plant. Yes, it is about sustainability, and sustainability is about making sure that whatever our population is, whatever it is we do it in a way that we minimize the impact on the future. We leave our children with the best possible chances of having the same opportunity for prosperity in the future as we do today. And that includes, you see, sustainability is much broader than just the environment. It has sociological aspects. It has economic aspects. It is the environment. It is the natural environment. It is the built environment. It is about doing things in a better way for a long-term better outcome. And as a country, a small island that has limitations on the extent to, on our landmass, limitations on our ability to develop without completely eliminating our natural environment or obliterating our natural environment, limitations on our ability to, handle any significant population growth. And by that, I'm talking about, some islands that may have a couple 100,000 people. I probably won't be around and probably won't be alive to see that if it came on. But I would hope that what we do today and what we do in the years to come will put us in a better position, that if we have that kind of population growth organically, that the country is going to be and the people are going to be better off, and our children are not going to be disadvantaged in the sense that they have less opportunity and they have less country, they have less heritage, they have less culture, and they have less of an environment in which they can grow up and enjoy the way we have.
Yep. And the third question is, what is the Premier's view on the proposed 30-year, $400 million bullet bond that can you explain in layman's terms why it's needed, who will benefit, and where the data and market analysis is taken from?
Let me start at the end. The whole point of the discussion around a bond, a long-term bond, is to just get information from the market, get an idea of what options are available to the country to finance its debt. We have made no decision that this is what we're going to do. We have done a request for information, and this is just to gather information in the normal way that you gather information in the marketplace, to try to understand if there are opportunities there to get money at a very low rate, and on a rate and with fees and expenses all rolled in, which when advertised over the 30-year period of the loan, make it a very attractive proposal. Once we've had that information, and we have looked at it to see whether it's very attractive, then we have to make a decision about whether this is a way to go. I do want to say this as well. In the normal course of, from an economic perspective, if you're looking at the debt of a country, we have a very low debt to our gross domestic product ratio. I think it's about 6% now, 5.5%, somewhere around there. With the borrowing that is anticipated, it is still going to be less than, I think I probably should be less than double digits, 8 or 9%, somewhere in that region. That is a rate, that is a ratio, which if you compare that to any other country around the world, is extremely desirable. Compared to any other jurisdiction in the Caribbean, there's nobody that has a ratio that low, even with that kind of borrowing. So from a financial or economic perspective, it is not something that is impossible. It is not something that is unreasonable. It's not something that is out of bounds for the country to consider. But we will be considering anything along those lines, and the information that we gather and the data that we gather in relation to market conditions very carefully. We started this process probably a month and a half, 2 months ago. And even in that period of time, the market conditions have sort of shifted against us in terms of, the potential to get a very, very good rate. But that doesn't mean we shouldn't continue to explore it. We have a facility in place now, and we are not discarding that facility. We have not abandoned that facility, but that is a short-term, it's a medium-term facility. It can be converted to a medium-term facility. And, we will continue to have that available until the middle of the year. We will have the discussions with the financial institutions, but for the coming several weeks, we'll be gathering information to see whether this is an option for us on a long-term basis. But no decision has been made, and it may be that it makes sense financially. Maybe it's a great deal financially. It may be that it doesn't. But what is certain right now is you can't look at the ratio. You can't look at the number and say, look, that's a really, really high number that we should never consider. That doesn't reflect reality.
So Cameron is saying Section 119 of our Constitution needs to be enacted. What's the status on it?
Geez, what is Section 119 again? I'll have to come back on that. I can't remember which one that is.
Sure, we could definitely come back to that one.
Unless Cameron knows offhand and can tell me.
It says, we know the purpose of press conference. Oh, okay, this is when we were talking about press conference. This is when Cameron wrote that one. Let's move on to another question, and then we'll look up Section 119. We're trying to stay away from, because a lot of the COVID questions.
I don't know what that one is. It sounds like they may be referring to referendum or something, or referenda, but a press conference is we don't have a type of government that you're governed by going back to the people and getting a referendum on every issue.
Yeah. So we have the next question that came in. When will we have a functioning council committee set up soon, or at least the framework for its launch?
I think that's a related question, and I think maybe that is. I'll have to look it up, but I think maybe that individual is talking about the district councils, and that is something that we're going to be turning our attention to shortly. We have people who have been given responsibility to start doing the review on that, so that we can take that forward. But that's something that will happen mid-year, or perhaps two-thirds in the fall, let's say. for the time being, we've got lots of other things that are ongoing. We are going to move forward with it, though.
Yeah, yeah. I was googling it and I saw that it is related to the district councils and stuff. And this is where having questions kind of sent in ahead of time would be quite helpful. I know you were mentioning that so you could sometimes do some research because you just can't keep everything in your head right away. So. We got someone here who is complaining about Travel Cayman. She called 3 times today and got 3 different answers. So I don't know what to believe at this moment. And then someone responded back saying, sorry, it would be 14. Okay, so they're just kind of commenting back and forth in the comments.
Yeah.
So we'll just keep on going through and see what else we have for you. Here's another one from Eden Hurlston. Good evening, Premier Panton, and good evening, Kevin. Regarding your statement in the Compass regarding not slowing down construction, given that we have no national housing and accommodations needs assessment and no comprehensive assessment for preservation and or rezoning, and that we have very few developers, architects, machine workers, designers, and ground crew trained in sustainable practice, how can we possibly steer development in this country in a sustainable, and the rest of it's cut off because it doesn't allow us to see the rest of it.
It probably says climate resilient way or something like that.
Mm-hmm.
I think Eden has misunderstood the comment that was made. The comment was in relation to a question from a reporter at the Compass, which basically said, you have projected a significant increase in revenue, stamp duty revenue, in this budget. And how are you able to project or predict that sort of revenue if your plan is to effectively slow down development and build in resiliency and sustainability? And my response was simply, look, you just stopping development in and of itself doesn't mean that you are building sustainability. We have to actively develop sustainability. We have to ensure that is the principles of sustainability and a strategy to implement sustainability across government, across ministries, across all of industry in Cayman. That has to be done, and it is not going to happen overnight, and it doesn't happen by simply saying, right, we're going to stop development today. You guys that have developments that are half done, you're going to stop. You guys that are considering developments right now, you are going to stop. We are going to wait until we know exactly how we're going to implement resiliency and sustainability across this country. Then we will allow you to sort of get back into gear and restart. Honestly, that is an expectation that doesn't reflect reality. Now, having said that, I will give no ground to anybody on their desire to have a more sustainable, a more resilient country, and good protection or better protection of our environment, both terrestrial and marine. I will give no ground to anybody on that, suggesting that they have better intentions than I do. They have a way of doing it. I'm happy to consider anything that anybody wants to come and engage with, but you're not going to tell me that because we don't walk in the door and say, right, everything stops today until we figure out a way to implement a better system. You're not going to tell me that that's a better approach. You're not going to tell me that that's going to have a better outcome for the country. We have got to make changes in methodical ways, in structured ways, carefully ensuring that we are achieving what we need to achieve, while allowing social development, some physical development, continued growth in the economy, because that's what supports our population. That's what enables us to have have a life. We've got to balance all of these things. And the comments that I gave to the compass do not in any way suggest that I am going to, allow or this government is going to just allow or support or promote a rampant development without any sense of balance, without any sense of ensuring that we have an idea of whether this development suits the needs of the country, whether this road suits the needs of the country. We're long past that. We have a National Conservation Act in place, which requires environmental assessments on projects that have major impacts, which requires environmental assessments or environmental impact assessments in relation to major road proposals that might have a major environmental impact. And we have to follow that process. Historically, governments have not wanted to do that. The previous government did not, and I repeat, they did not do an environmental impact assessment for the East-West extension from Newlands up through to Frank Sound. I can only tell you that when I was minister in 2015, I said at that time, we need to do an environmental impact assessment in relation to that. I have maintained that position. That's legally the position. And what has been attempted in the past by a variety of actors is to try to prevent the National Conservation Council or the bodies which should be rightly involved in assessing the impacts on our environment and how to get a better result when we're doing major projects like this out of the way. They have tried to get them out of the way in the past, but that is not what the people of this country want. The people of this country want a process which gives a better result, which minimizes the impact on them. We have had too many instances here where things have been done, roads have been built, projects have been approved, and it creates flooding in places that never flooded before. So there are knock-on impacts, there are consequences to our actions, and we've got to do things in a proper, methodical way, in a planned way, so that we actually see and assess the potential impacts and mitigate those impacts. That is what we are trying to do. That will leave us with a better country, better results for our people, and long term, we are going to have infrastructure that is smarter and better and serves the people of our country, makes their lives better.
And then right after that, we had a comment coming in from Cameron saying this administration won't get no pats on their back, claim accolades, or receive praise if they're not prepared to give us our district council. So again, the same person responding.
So that was, that's what they should have just raised to begin with. But as I said, that is something that we have on our agenda. But I don't know. I think people seem to have the idea that these district councils are going to be making law and are going to be legislative bodies. They're not. They're bodies that help the MPs for those districts and for those constituencies be more closely advised and informed of issues and better able to to represent those particular constituencies. They're not bodies that are lawmaking. They're more administrative in nature. They're more gathering of information and sharing of information in order to get a better outcome for the constituency.
And how can we ensure our kids' futures and opportunities without slowing down irresponsible developments? If growth is to happen organically, why are we doing wide-scale development with no development plan?
Well, I think if people had been paying attention, they would see that we have said we are working on the revised development plan. We have not had a new development plan since 1997. Now, the previous government did start efforts to address this, and they came up with a Plan Cayman proposal that I think in the last 2 years of the administration, they did some work around that. They did public consultation. So we are looking at that, to continue to take that forward, or at least take forward the things in it that make sense, and to try to do things differently. But development planning is a difficult approach, difficult initiative, and it is not something that happens overnight. Um, it requires a longer term commitment to getting a better result for the country, and for the infrastructure and the developments that we have in the country. Um, Irresponsible development is not desirable. Not desirable. Now, there will be questions around, well, what do you mean by irresponsible development? Some people will see any development as irresponsible. Um, I don't necessarily agree that that is the case, but we can certainly try to ensure that whatever is done serves the needs of the country, serves the needs of the people, and is done in a way which minimizes its impact on our environment, its negative impact on our environment, and that comes about through mitigation steps. That is through, in some cases, having environmental impact assessments with big projects to make sure that we understand what those impacts are, and we understand how best to mitigate those impacts. And sometimes, yes, if those impacts cannot be mitigated sufficiently, then we don't allow the project. It's as simple as that. And sometimes the project may not suit the needs of the country.
Yeah. And so just want to remind, because obviously this person has a lot of comments coming in, and want to remind folks that, if you have something that you want to actually, explain, especially just like saying something like 119 is sometimes a little difficult to follow. It would be to your own benefit if you just go ahead and call into the show and be able to ask Premier Panton your question directly. We could definitely facilitate a conversation for a short period of time before moving on to what others have to say. So again, we do have that call-in link. It's Cayman Mall Road /talk show. It's very easy to get on. I'll see when you come in backstage, and then we can just pop you up for a short period of time so you could go ahead and answer or get your questions answered. So we want to make sure that we remind people of that as well.
Yep. I think just on that, as a final comment, the point is that all came about because of a response to the compass. And in that response, I said that simply stopping development doesn't mean that we're going to automatically have sustainability implemented. And that was taken to effectively mean that I am in support of unrestrained development, it seems. That if you look at the different arguments that are made, that seems to be what was taken from that. And that, with the greatest respect, is a misconstruction of what I said, a misunderstanding of what I said. In the same way that, I am not saying that Eden says he wants to stop development. I agree. We need to have sane development. We need to have sustainable development. We need to have development and infrastructure that serves the interests of the country, the long-term interests of the country. It cannot be just about opportunities for someone who comes in on a plane to make money, leave the country, and leave us with whatever long-term problems that flow from that development. It has got to serve the best interests of the country.
And Emma, back to COVID-related thing, please can you put my question to Premier Panton regarding 4-year-olds getting tested? HSA is insisting and have threatened that I am in breach of the regulations if I don't have my 4-year-old tested on Friday and will be arrested. Can Premier Panton address this issue, as I'm sure it affects many children and families? Thank you.
So 4-year-old getting HSA are insisting and threatened that I'm in breach of the regs if I don't have my 4-year-old tested on Friday. Well, I'd have to know the circumstances, but yeah, typically, I don't think 4-year-olds are necessarily being tested right now, but I don't know for sure, and it also depends on the circumstances. I mean, is it a 4-year-old that is positive? You know,
Yeah.
I don't know.
Yeah. One of these things, a lot of these COVID type questions, and legit, there's a lot of people that still have a lot of questions, a lot of uncertainty, and from what I'm getting is a lot of people are being told different things. It would be really, really good if we could get someone to come on from HSA, because I know this is outside your lane. You're the premier, and yes, you are briefed on a lot of things, but some of these things are are best answered by those in those positions. So I'm reaching out to those folks if you would agree to come on, and we could definitely get these questions better answered, and kind of allow the premier to answer premier lane questions and get the health authorities to answer health
Well, I don't mind.
related
I don't
things.
mind, but I've got to have more specific information in order to answer some of the questions.
Yeah,
Um,
absolutely.
I mean, I don't know what this, whether this is someone who's positive or whether it's someone, who's coming out of quarantine. I don't know. But I doubt that the HSA would be threatening anybody with breach of the regs if it didn't relate to somebody who was positive. And that's understandable. And in some instances, and well, let's put it this way: there may be changes that are coming which will have an impact on some of the scenarios that I could contemplate based on the limited facts that the person has set out here, which would probably change the answer at that point compared to what the answer is today.
Got it. So Carolina is saying doing better than the PPM is not the ask. Premier Panton, we are looking for solutions that reflect the urgency of the climate crisis, which is a very real threat to our very existence as a nation. That is the ask.
And that is the challenge that we have. That is what we need to be doing. I absolutely agree with that. I am not trying to be better than the PPM. I'm trying to do what is best in the long-term interests of this country, and I'm trying to ensure that the government takes the issue of climate change and the potential very negative impacts that are implicit in that to our existence. As she says, it's an existential risk to us. If we have, let's put it this way, there are many places in this country that are 4 feet above sea level. If we have, there are some places that are 3 feet above sea level, some places that are 2 feet above sea level. So if we have a 3-foot rise in the next 40, 50 years in sea level, anybody who's alive at that time is going to be standing to their ankles in seawater. These are real risks. And it's not just us that are facing this. We have to find answers. We have to make our country more resilient. We've got to build resiliency to these risks. We've got to find ways to reduce our output, our contribution of greenhouse gases, which is high, right? On a per capita basis, we have a lot more greenhouse gas emissions than many countries that, on a relative basis, that many countries who are a much bigger problem in terms of their overall contribution. So we have got to address our problems, and we've got to address our solutions to reduce that. We've got to build our resiliency. But people have to understand that these things cannot be resolved in a period of months. I have a variety of committees. I have a variety of experts that have been hired in. We have our own experts that have already been on board. We are working in cross-ministry teams to address issues in relation to the beach, to address the issues in relation to beach renourishment, because we're losing a significant part of our national asset. We have cross ministry committees that are working on setback reference lines to avoid a situation where, and I really can't get into it now, but there's, we've had an abusive process going on for a very long time, and we're trying to bring some sanity to that approach and create some realistic setbacks that are a balance between allowing people to do some development or redevelopment in some cases, whilst minimizing the impact on our coastlines. We have committees that are, we had on Friday, I had a full day session with my ministry team and others around how we are structuring our approach to sustainability, and how do we roll that out to all the different ministries across the government, across all the industries in Cayman. How do we align all of the different private sector organizations that are now contributing to that and are involved in that and are engaged in that, and make sure that we get the best result for everybody? Because if we can bring all of our efforts together, if we can align them, we then have a much more powerful engine to drive sustainability and to drive improvements in climate resiliency. But do we have the answers overnight? No. Are we committed to doing it? Yes. There are people in the private sector that I know that are so interested. Some of the people have asked questions here tonight. Fine, let's engage. Let's continue to work together, because our collective thoughts, our collective experience, our collective intelligence is going to be better off for all of us at the end of the day if we're all working together. If we're all rowing the boat in the same direction. But if you expect to have something done immediately and overnight, that's not how things work in the country. I recognize that there have to be efficiencies, that we have to improve the speed of responses. And we have to balance everything. I can't do things alone. I have to have the support of my colleagues. They have different constituencies, and politics is about getting a good result based on a set of compromises. But there is a reality that if we have too many compromises going on, we lose where we need to get to in order for our country to have a sustainable future, and for our children to have a country to live in, and that they can enjoy the same quality of life and the same kinds of environmental parts that are central to our soul today in their lives.
And Cameron is asking, can we please stop concessions to billionaire developers whose sole purpose is to get richer and use us to further their own agenda, while we continue to grasp for straws?
Well, this government is not at this point considering any concessions to anyone. There have been concessions which have been agreed in the past that the government may be committed to legally, but we are not having any discussions with anyone, billionaires, millionaires, or otherwise. Certainly not for the sole purpose of letting them get richer. I mean, this is about making sure that what is happening in our country is for the benefit of the people of the country and the long-term benefit.
So Melanie is saying, what sustainable initiatives do you plan to implement in 2022 to address the COP26 concerns for emission targets, as well as sea level rise and habitat threats? Example or alternative e-transport, considering a pause in beach setback variations and enhancing species protection by setting higher penalties.
Well, that is what I'm saying. What I was saying earlier was that's the very type of thing that we have been working on within the ministry. I've been building out staff. we have been working on building out the initiatives and the structure which will support the development and driving sustainability of sustainability initiatives. That includes issues around alternative and electric transport. That includes addressing beach setback issues, making sure I've already outlined that we are trying to change, and we've already approved in principle an approach to a reference line for setbacks. Now the committee is working. It's a cross ministry committee which is now working on the specific types of setbacks and for different types of developments, which we don't want to see variations on. It's too often we have seen variations being the rule rather than the exception, right? And we have to have a rational approach to this, something that makes sense, something that reflects our reality in terms of achieving sustainability and in terms of achieving climate resiliency. And I don't want to see a situation where we continue with this Wild West approach of all kinds of variations being granted because somebody comes along and promises that it is going to deliver 10,000 jobs and $500 million into the economy. And we never do anything. We've never done anything historically to measure whether that's the case anyway. And those are the types of things we do need to do. But before even doing that, we need to assess whether we need to have a structure within which we can assess whether a development is the kind of development that will add to the country, add a quality infrastructure, add the right kind of jobs. It's done in the right place that we want to see development occurring. It fits in within our existing infrastructure plan and future infrastructure plan. We've had so much ad hoc development going on all over the place, and governments over the years have been trying to respond to all of this without taking a planned approach. And that is what we need to do. We need to have a rational approach which reflects sustainability, which reflects a commitment to climate resiliency. And we need to ensure that those requirements are followed and not just varied because somebody says, yeah, I want to do that.
Yep. And so we have Eden actually coming on in. He's called on in. So Eden, you could go ahead. I think you have some questions.
Hi, how are you doing? Good to see you guys. Good evening, Premier Panton. Thanks for bringing me in the studio. I thank you for fielding the questions earlier, and I don't want to be misunderstood in saying that I want no development or anything like that. It's about development, like you said, that benefits future generations in the country. What is happening on my road of up here in West Bay, Premier, is we have 5 luxury scale developments of different kinds, accommodations, residences, investment properties that are happening. That's just my one road. Yep. There's 3 others where they've cleared the land that haven't been set through for approval. And then there's a Barker's Beach Resort, which is on a property that's already developed. So all in all, we have about 8 large scale developments going up just in this area, just on one road in West Bay. Mm-hmm. I don't know if you've driven Northwest Point lately, but my fear is that by the time we make a plan for implementing sustainability, there simply will not be very much land or coastal areas left to protect, or mangroves left to protect, or places left to develop sustainably. We have large-scale development going on by people who don't understand sustainable practice, and it's being done in ways that do not seem responsible either to the community or to the country. And so I'm having difficulty understanding if how we implement a plan and how can we implement a plan when everything is moving at such a fast pace. And again, I don't expect things to happen overnight, but acres and acres of land got cleared right up here by me overnight. the tons of carbon that it sequestered, the tons of habitat that it provided, the tons of buttonwoods and everything up in there were gone, literally in one day. Okay, so that is happening overnight, and I feel like the people need to see move forward in that direction. So my question is simple: is the scale and pace of what is going on being appreciated by government? So is there a move to implement Plan Cayman and do a housing and accommodations needs assessment? And how is it possible to do that without pausing this juggernaut that's going on? I've talked to experts, I've talked to the ecologists, I've talked to the scientists, I've talked to the developers, I've talked to the builders. I have a difficult time seeing how we can implement a sustainability plan when we're developing so rapidly. How do we do this? And I'm here at your beck and call. I helped draft the Amplify Charter. I'm a big believer in putting people being a part of the solutions and people putting forward their solutions. I'm a huge believer in that. But while we're trying to address CPA meetings and deal with all of a sudden a bunch of things getting knocked down in an incongruous manner with the law, and how do we keep up?
Look,
how do we deal with this?
I understand your frustrations. I understand your concerns, right? But understand that I was responding to a comment which suggested that somehow I was in support of allowing rampant development without any rationale for it, without any needs assessment. I am not. I am in favor of things getting, environmental impact assessments. I am in favor of needs assessments being done, whether it's housing or whether it's infrastructure. We should, as a country, plan all of these things. We should make sure that we are clear on where we want people to build. And encourage and incentivize that, rather than just leaving it up to people to come along and say, hey, you know what, I think that there would be a good spot. We should enforce the planning laws that say you can't clear your land without planning approval, right? That is, to me, that's a fundamental thing. And we should also ensure that people don't clear land just for the sake of clearing it, because that has a major impact. As you have outlined, you've lost the ability of that land to contribute to carbon sequestering. You have damaged the habitat of probably any number of species. Why? Unless you are going to do a development there that's imminent and it fits within what the overall country needs and wants to do, there is no need to be doing that. I don't know, historically, people have had this idea that they buy a piece of land and they need to see the four corners of it and it needs to be wiped clean by a bulldozer blade. That, to me, that destroys the land.
I agree.
When I buy land, I love to go and look at God's creation. I love to look at the incredible array of trees and stuff. Yeah, I know a lot of land has a lot of trees like logwoods, for example, that are not indigenous.
Mm-hmm.
But it's still habitat, and we still have a lot of good Caymanian things like our national tree, the silver thatch palm, and all that in there. People need to be more conscious of these things when they're clearing land, and when they're doing developments. There has to be a clear rationale around it.
But are those things going to be implemented into policy? Because here, DOE has been after footprint only clearing for quite a while. They've tried to get it implemented, from what I understand. So are things like that actually being pushed to planning to say, hey, we're going to leave some trees around the perimeters and we're going to look at footprint only clearing of land? And is this coming to fruition? I mean, the things you're talking about, are they translating into policy? Because again, right out here, there were at least 100 silver thatch on that land that got just cut down. They were just bulldozed. Yeah. Next door to me, the woman knocked every single one down. And so there's no protection for it. There's no people that come out and say, oh, we can dig those out. We're going to move them somewhere else. And that's just the tip of the iceberg, really.
Exactly.
Are these things getting put into policy, the type of things that you're talking about?
Well, as I said to you, we have engaged. We had the entire ministry. We had the Department of Environment. We are looking at ways to take this forward to make sure that working together we can achieve these things. This is 2022. We've got our own budget in place. We have our agenda that we're moving forward on. Now, we have been really distracted by what has been transpiring in relation to COVID, but it's time for COVID to not be an excuse anymore. You know, if I have to, I mean, it's 9:30 and going on 10 o'clock now. If I have to work these hours of the night to deal with COVID and deal with the other things that are important to the long-term future of this country, then I'll do that too. That's what I'm doing right now. That's why I'm here engaging with you and engaging with everybody else on CMR.
And I appreciate that, sir. I do.
You know, sometimes I feel, sometimes I feel a sense of frustration because despite how hard you work, you still have people, even the people who you regard to be on your side, criticizing you and saying you're not doing enough. But I would rather you come and tell me that I'm not doing enough, and let's figure out a way that we can work together to achieve more. Because publicly attacking on an issue that requires an issue which is a significant change in approach, a change in focus, isn't helpful because it sort of gives ammunition to those who perhaps have a different agenda. And let's face it, you know as well as I do that there are those who do have a different agenda, who don't share the view that we should have a Cayman which has the long-term benefit of our children reflected. A lot of people have an attitude of, I don't care. I care about my prosperity today. I don't care about the prosperity of our children tomorrow. And I don't want that. I want sustainability. I want an approach which says you can achieve your prosperity today by doing things in certain ways which do not destroy the possibility of our children of tomorrow to have the same opportunity for prosperity too, to have the same opportunity for an incredible environment which reflects our culture and our heritage and things that we grew up and things that we identify as part of the signposts in our soul. I talked about things like that when I was here as an environment minister in the past. I still believe that today. I'm in a position where, there is more influence, and we have a government that is more committed to that than any other government that I've seen in the past. But we are trying to get these things done. We have all these other competing issues and trying to get the COVID issues sorted out. We're going to be working on this, and I look forward to working with all of you that can contribute. And I know some of you have these issues totally at heart, and you want to make sure that we can do this together. And I look forward to doing that because I share the same care and concern for our country, for our environment, for our children. I don't have any kids that are very young now, but that doesn't mean I can't want the best for your young children either, because I know if we don't do it, there's nobody else that's going to do it. And we are running up against the deadline. We have to get moving.
Yes, I agree, sir. I do. And I really feel like we need to sit down with the developers, because a lot of those people who do not have our best intentions in line for the future are developing our country really rapidly. That's a lot of those people. We have to sit down with them and tell them this is not going to work anymore. I'm begging you.
Yeah. Well, I have had conversations with some of them. The reality, I think, is this: there are those who feel threatened that an approach to ensuring sustainability is somehow going to destroy their ability to make money. I don't believe that's the case.
No, it's not.
I don't believe that's the case at all. I believe that they can find projects, they can develop this country, they can contribute to making this country a better place, still make it rewarding for them, and at the end of the day, leave the country in a better position. A lot of them are Caymanians. A lot of them have kids here too as well. And those who aren't Caymanians, they have kids who have sometimes born here and grew up here, and they have no idea. They're not going to tell me. They may themselves think, well, I'm going to go live somewhere else probably, but they don't know what their kids are going to say. Their kids might say, you know what, Dad? You know what, Mom? I really love this place. Cayman is just a jewel, and I want to stay here. I want to make my long-term life here. So please help everybody leave something for us and make sure that we have a future that's sustainable as well.
And Carolina is saying we all agree on what should be done. So who will take ownership for the should and turn that into a will be done? Who will ensure laws are enforced? Who will lead the change on planning? Where does the buck stop? Who is ultimately accountable?
Well, those are a series of questions that would take all night to answer.
I'll leave you with that one from Carolina there. Thank you very much for your time, Premier. Thank you, Kevin, for having me in the studio.
Thank you very much.
Appreciate it. Thank you. Have
a I'm happy to have a conversation. The buck stops with the government, but the buck stops with the people too, right? Who is ultimately accountable? All of us. Who suffers? All of us. Who ensures the laws are enforced? Of course, it's the government. It's the authorities, right? Now, I want to make sure that what we are doing reflects, as I said, the best long-term future for this country. Sitting here tonight, you can ask me 10,000 questions and I can answer 10,000 times. It's not going to help us move it forward tonight. Tonight, I'm just going to go home more tired, and I'm going to get up tomorrow morning and I'm going to come back and I'm going to try to achieve the same things that you're talking about. I'll just be tired doing it tomorrow morning. Oh.
And we got the last question, or we got the last comment actually for the night. If you wanted to just wrap in your final thoughts with this, but Cameron is saying, keep that fire, sir. We have a long road ahead. Don't let someone looking out for their own shine take that shine or take that shine away from our children or grandchildren.
I appreciate that from Cameron, and anybody who knows me knows that this fire is always here. It's always burning. I'm always trying to push forward and accomplish the best for this country. I love this country. I do things. I'm here in this office. I ran for politics, not because I wanted a job, not because I needed a job, but because I wanted to address some of the issues and contribute something meaningful to the country, to make this country better for all of us, for our kids in particular. My legacy and the legacy of this government, I want it to be one which people look back on and say, you know what? They put in place policies, they took actions that benefited the whole country. I'm interested in what the future holds for our kids, but if we don't mind the present, if we don't put the things in place that ensures that they have a good future, it's not going to happen. It doesn't happen by accident. This haphazard development, this approach that we've taken over the years has worked well, but obviously it's getting more and more difficult. It's getting harder, and it's having, we're creating all kinds of dislocations. We have all kinds of inequality. People do not have equal opportunity. There is such a thing as privilege, and it needs to be addressed. We need approaches that give everybody the same opportunity, rather than just those who have a privilege for something, whether it's because they have a lot of money or whether it's because they come from a particular family. We should all have the same opportunity to have our best lives, to create, the best impact, to have incredible families, to love our communities. It is something that you do for, the progressives had an expression of love of country. It was a part of their slogan, but it's not unique to them. I was a part of the progressives. I always loved that. I still love it today, and I will use it because it's not unique to them. It's not owned by them. And as the former premier used to say, you may love this country as much as I do, but you can't tell me that you love this country any more than I do. And I believe that was the case with him then. And I know that he knows that is the position with me today. And I want everybody to have a fair chance and fair opportunity. And I want the best outcome for our country. I got to tell you, my friend, it is always a pleasure to be here talking with you and talking to the people of the country. I got to tell you, I'm getting very tired now because I've been on the go all day. And we delayed this session by a half an hour because I had to finish a cabinet meeting, and then we have a press conference tomorrow. So the week has nowhere near finished yet, and it's time for me to head off. But thank you very much, Kevin, for stepping in. As always, you are a perfect gentleman and a master stand-in for Sandra. And I want to say good night to you, to Sandra, and to all of the people who watch CMR. Have a wonderful evening, everyone. And we will try to make the rest of the week better for everybody.
Thank you. And thank you. 2 hours and 20 minutes, sir. That is a long time.
All righty. Thank you. Have a good night. Have a good night, all.
Good night.
Take care, my friend.
Well, that wraps up our show for tonight, and we'll see you in the morning. Good night, everyone.
Good night.
The Cold Hard Truth now has your Premier access with Premier Panton.
Hello everyone, this is Wayne Panton. Come and join me on Cayman Mar Road's Premier Access every other Wednesday at 7 p.m. for a frank and open Q&A session. I'm here to answer your questions about the issues that concern you the most. Tune in to YouTube and Facebook Live on Wednesday. We will see you there.
Full transparency, answering your questions, down to earth, accountable, and accessible to who matters. You. Don't miss Premier Access on the Cold Hard Truth, spilling the tea like no one else.